So here in Injury Concepts again, obviously one of the heroes of musculoskeletal understanding has got to be Vladamir Janda. Okay, there's two main concepts that come out of Vladamir Janda's work that are extremely helpful in you guys not only identifying which of these patterns that you have, but understanding at a deeper level the different neurology associated with the muscles of your body. And we'll talk about that in this video. There's some really great stuff here, particularly in our modern age, what Dr. Janda studied quite a bit, particularly with upper cross syndrome and lower cross syndrome, is our modern life of sitting and computing. Now we have some other elements too right now, particularly the younger generation that are looking down a lot. And this is quite different than the anterior head carriage associated with upper cross, which more looks like that. So there's a difference between looking down and having my skull turned downward than to looking at a computer screen with my arms slunched forward on a keyboard and a mouse set up like this, as you can see. So let's talk about those two particular patterns, how they relate to pain, and what Dr. Janda's work did to explain to us how we can fix it at home for free. In upper cross syndrome, Dr. Janda studied quite a bit of the muscle firing patterns associated with computing and the what they call anterior or forward head carriage, my head lying forward. And there are two main muscles in the front of my neck here on the side, sternocleidomastoid and scalenes, which contract to draw my head forward. Hence that posture forward. And imagine if I sit all day every day as a programmer or in a cubicle at an office, which many of you are, and your head is jutting towards a screen. This is particularly evident when people have poor vision and maybe haven't had that assessed. But the ergonomics of your workstation are extremely important to try to enhance this, and we're going to talk about this a little bit later, some of the solutions. But let's focus right now on Dr. Janda's upper cross syndrome, where I have a muscle that's deep in my neck that performs this motion is shut off because it's always being overwhelmed by the two muscles that perform this motion, sternocleidomastoid and scalenes. So the idea is to turn on the deep neck flexor, the one that does this, a chin tuck head roll, and shut off the sternocleidomastoid and the scalene group so that I can normalize. The third player in this is a suboccipital group. Just at the base of your skull, and I'll include some pictures for you guys to see what this looks like, are 8 muscles. Those 8 muscles are there to perform various small micro functions of the way my head articulates with my first vertebrae and my second vertebrae. These muscles are only found between the base of my skull, my first vertebrae, and my second vertebrae, and they essentially, when they contract, will do this. So we can imagine if I've got myself jutting my head, anterior head carriage, towards a screen for many hours a day, I might adaptively shorten these suboccipital muscles, and it looks something like this. Now that gap between my skull and my first 2 vertebrae has shrunk, thereby allowing those muscles to stay in a shortened position for many hours a day. What generally leads to headaches and the upper cervical pain patterns, or pain that's originating from the top of your neck, just below your skull, is the upper cross syndrome pattern of adaptively shortened suboccipitals and sternocleidomastoid and scalenes, and adaptively weakened deep neck flexor. Wow, all that. How do we correct it? Well, Dr. Janda had everybody lie down on a bench, let their head fall back, and practice a chin tuck head roll movement. Looks something like this. Notice I'm tucking, I'm not just pulling my head forward, I'm very actively engaging my deep neck flexor and my platysma muscle to do this. And if I'm doing that on a bench, lying back with a little gravity and the weight of my head working with that gravity, that will slowly unwind the shortening pattern. It uses a concept called agonist-antagonist relationships, or reciprocal inhibition. What is all those big words? Agonist, antagonist. If I make a bicep muscle, my tricep muscle has to shut off. These two muscles, one doing this and one doing this, cannot act exactly at the same time with the same amount of modulation. So when I'm doing a curl, I might be 90% bicep and 10% tricep. And when I'm doing a tricep extension, the opposite, I'm 90% tricep and 10% bicep. These muscles are never completely off, even though they're not the active movers of what you're doing. They remain dynamically on to balance the load across the joint lines that they're attached to. This is the same in the head. So when I contract my deep neck flexor, I'm shutting off my suboccipitals. And it's a beautiful way that Dr. Janda identified these patterns and figured out a way for us to, at home, restore the normal relationship of agonist-antagonist, or a mover or a muscle that opposes the movement. The agonist is the mover, the antagonist is the muscle that opposes the mover. And they go back and forth depending on what your position's in. If I want to extend backwards, my agonist becomes my suboccipitals, okay? But if I want to jut forward, my sternocleidomastoid and scalenes become the agonist, and the antagonist group is the suboccipitals. So, lower cross deals with the lower body, similar pattern. So if you sit all day long and your legs are at 90 degrees to your body, you're going to find that the hip flexor muscle, which is lying deep into your pelvis, is in a shortened position all day long. And you're going to find that the lower back muscles are in a shortened position all day long, and that's the cross for the lower body. And you have weakness of the abdominals and a weakness of the gluteal muscles. You're sitting, so you're not using your glutes. You're sitting, so you're not using your abs. And there's an imbalance because one group of muscles is contracted and shortened all day, and the other group of muscles is lengthened all day. Over time, this is not something that happens overnight. It doesn't happen very quickly, but much of what you guys are experiencing pain-wise is coming from these long, slow, insidious problems, and not so much the beautiful, simple, you went to the gym yesterday and you lifted up a weight, it was too heavy and you felt something either tear or you felt an injury process as it was occurring. Those are quite simple, acute, with no mechanism of injuries. Most of you guys are dealing with repetitive stress problems that are really slow, really insidious, and they need to be looked at using some of Janda's work, because Janda studied these patterns over a period of time and found that this is what develops over time. Here's the other cool concept: phasic and postural. One of the pictures I show a lot of my patients in the office is the architecture of the low back and of the back. Now, if I were to peel off your skin, I would see a group of muscles that form the shape of my body. My lats, my upper trapezius create quite a bit of the shape. My middle trapezius isn't something that I see, but forms the shape of my mid-back area. And those muscles are very superficial. They're the ones that are just underneath my skin, so hence the shape of my body as it fits into a shirt or it fits into clothes is related to the outermost layers of muscles. Also keep in mind that these muscles are very sheet-like in many cases. There are some round tubular kind of muscles, but a lot of the muscles that you see in the back are really long and sheet-like and layered. So it's an extremely important concept to understand that they are layered and they're not tubes that are pulling on it. A bicep muscle, again, is more of a thick tubular type of a muscle. It's a bipinnate muscle, whereas a lot of the other muscles are less amorphous. They have less shape in that regard, and they're flat and they're layered. If you go to the intermediate layer in the back, you're going to find paraspinal muscles. Those are the long, skinny ones that run parallel with your spine. And then deeper to that, at the deepest level of the back, the problem children of the back, if you will, are the multifidus, semispinalis rotators. Let's take those three groups again and we'll talk about phasic and postural. A phasic muscle is a muscle that really lies quite quiet and doesn't really do much until my brain says activate. So if I were to take this pen in my hand and reach out, I have now cognitively asked my body to reach out and grab the pen. And these are my phasic muscles. They are off until my brain tells them to do something. But as I go to grab anything, my postural muscles have to fire very quickly, otherwise I would flop to the ground or I might fall off balance. So this beautiful synchrony takes place of my frontal lobe and my motor cortex saying, hey, reach for pen. But the other beautiful that happened that you don't have to think about at all, related in a couple of different systems, but for this video we'll just stick focused here on the postural muscles, is the deepest muscles that hold the spine together itself. They are micro movers of it. They stabilize my body while my broad phasic muscles do all the work. So I'm reaching out, I'm lifting weights in the gym, I'm reaching for something in my cabinet, and these are all, these are all activities that I've asked my body to perform for me. But all the while, I've got a group of deep postural muscles that are holding me up and making sure my frame doesn't just collapse as I rapidly change positions and my body is constantly having to jibe with that in some way. And so what you find when you do this for a living all these years, I tend to find I'm constantly digging down. And many of you can probably relate with this. What you're relating with this, when you go to see that massage therapist, you're like, please go deep. I want you to do a deep tissue release on me. There's probably a little intuitive sense that your brain is telling you that the pain that you're experiencing is coming from the deep stuff. That's why everybody wants me to dig in deep when I do it. I'll have some other videos regarding this and not bruising the deeper tissue, but I have to say, Janda's work really sings to the fact that the deep postural muscles are where a lot of the pain patterns arise from. And so, again, peeling away the body, 3 layers. 1, outer, phasic. 2, intermediate, postural. And 3, deep, postural muscles that hold me together, stabilize my system while I perform broader motions. So the takeaway here is to fix these dysfunctional patterns that Janda has exposed here with his upper and lower cross, you must understand 2 key concepts. 1, that some muscles are just not going to do anything until you ask them to do something, and some muscles are going to stay on all day. And when they stay on all day, they're going to get tired and fatigued and more likely become the reason for you going to schedule a visit with a massage therapist or a chiropractor or an acupuncturist or a physical therapist. So again, great methods here, can be done at home. A lot of you guys are using foam roller work. I have a couple of devices on my BodyDoc online page that you can go check out that do some shiatsu compression things and help restore some of the motions of your spine. But ultimately, much of the work that you're going to be doing is going to be digging down deep into these postural muscles and not so much focusing your attention on the phasics, the larger muscles that move you around. I hope this helps. There's a lot of information here on this particular video. Take it in, watch the video a few times. Remember, the more you know, the less you guess, and the less you're going to pay.